First one, hi ladies, I thank you for your show. It gives me strength to move on the days that I'm so depressed. My son is over 4, and when he was 3, he would script a lot, then he stopped. Recently, he is doing that and making lots of noises. He mainly scripts movies and shows. What can I do to help him with that? And thank you.
There's a positive thing to scripting, and then there's obviously a negative side to it as well. So scripting usually only occurs in children who are pretty high functioning because they're trying to communicate. Obviously, though, it's not an appropriate way of communicating, and you have to teach the child to let's say, apply the scripts in context, and then also to modify the scripts and actually converse with the regular language. I can't give you a short answer to that, because really, if you have a child who's slightly over 4 and is scripting, the number one recommendation I want to make is please get your child intensive and high quality ABA, because you have the child that would really, really benefit from an intensive ABA program. And so that's really all I can tell you right now. Generally speaking, the attempt in ABA is to try to replace the scripting with more appropriate language, but having said that, it's a very gradual and stepwise procedure, because the scripting is, as I said, an attempt to communicate, and you don't want to reduce that or eliminate it until you have an appropriate replacement. So please reach out to us if we can help you. I don't know where you're located, but Love My Provider is also a good resource to help you find a good ABA provider.
Yeah, and definitely check out centerforautism.com to see if you're close enough to an office that it just is an easy fit.
Right, or if we can provide remote services,
Absolutely.
We're happy to do that as well.
Absolutely. One of the things that I think about is that I sort of think, looking back, about some of the different stages of a child with autism. I remember for me that when my son lost language, and all I was panicked about was, when is he going to speak? When is he going to speak, right? That was my biggest concern. Then, and that was, I just like knuckle grip on when is that going to happen. Then when he started to speak, but he was doing some movie talk, then there was the new panic of, well, is that all it's ever going to be? Is that all it's ever going to be? Are we going to get to natural speech? Are we going to do that? And what someone finally said to me was, you're going to have to loosen a little grip on that, or you're going to drive yourself crazy, which I eventually did. But to realize what I had forgotten about the kids that I knew that were neurotypical, they will sometimes go through a phase of where they do that too. And I had forgotten that.
You have to realize, and this is important for you as a parent, the person who wrote in, because you did mention that you're depressed on some days, and it's important for you to realize that scripting is really just repeating language that you hear over and over again. That's what it is. That's why our kids go for scripting from video, because it's probably a video they've viewed hundreds of times or tens of times. So it's not a bad thing. It shows a lot of good positive things, intelligence, memory, all these and the desire to communicate.
Yeah. So
it's a good sign, and I would really, really recommend that you get your child in intensive ABA. There are very few locations in the country where you can't get this funded now. And I really encourage you to do that, because your child will probably have a positive outcome with this.
Super duper advice. All right, we're going to take a short break, and then we're going to come back to talk more with Dr. Doreen Granpeesheh. Stick with us. Welcome back to Autism Live and to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh. She's answering your questions. We were just talking about a question about a little boy who's scripting, right. And there was something we decided during the break that you wanted to add.
Well, it just occurred to me, Shannon, that I'm telling a parent to get an ABA program, and perhaps you already have an ABA program, and your provider may not really know how to go about handling scripting. I'm not sure. If that's the case, and if you just want to learn a little bit more about how to handle scripting, then I would suggest you go on our skills website, skillsforautism.com, and you would, get, I think you have still a 2-week free membership or something, but I would suggest that you go into the section for I would say it's probably in social skills, the domain social skills, where you will find a lot of information about how to handle, and lesson plans specifically for handling scripting. It would be under social conversation, I think, and I'm not sure if that's in language or social, but take a look at it.
There's a little bit in both, as I recall. There is a whole social language in the language department, but then there are some goals in the social
domain as well.
Yeah, and I use skills. It's amazing. Skillsforautism.com, so useful. Okay, I'm going to move on to the next question. Hello, Dr. Doreen and Shannon. You are so instrumental.
Oh, that's awesome. Thank you.
My developmentally disabled, because they wrote DD, so I'm just translating, 7-year-old, high-functioning, using skills. We are still working on perspective and language, have off-topic rigidity and self-stim behaviors, which are minimal, but they're mostly when she's mad. Question: she is progressing in language and now doing some spontaneous questions to peers, thanks to skills.
Awesome.
Gets mad when things don't go her way, i.e. peers don't want to change the setting of play or don't want to follow her when the dog barks or rains when she wants to play outside. Then she'll push friends or tap their arms while repeating words, I don't want to go running, when no one is running. This escalates to a scream or a cry. She's in an inclusion program going into 2nd grade. Nothing helps. We need to do something before school starts. This behavior is 4 months old. We are doing social stories and working on expressing her feelings and addressing the moment, but it's not working. And they said, thank you, we love you.
Oh, that's wonderful. Thank you so much. Well, you're working on perspective taking. Clearly, at the moment when this is happening, she's not able to take the perspective of the peers. So you should probably do a couple of different things. I'm just throwing ideas out from my head here, but you can also get supervision from us if you want. You can also connect with us, and we will provide you a supervisor who can give you some more guidance on all of these. But essentially, my suggestion would be that you do comic strips, and I think we have comic strips in one of the lessons. I'm not sure where, but the concept here is that you would separate, not in the moment when this is happening, but as a lesson separately, you would start acclimating your daughter to drawing a comic strip. So you draw a picture, sort of what are they called, straw man, or what are,
stick man.
Stick man, thank you. These are the moments when English becomes my second language. But so you draw a stick man type figure, and that's her, and then you draw another stick man, and that's the other person, and you're just sort of visually demonstrating for her how they're interacting. And so then you will do speech bubbles and thought bubbles, and then inside the heart area kind of feeling bubbles. So you would do, okay, I'm thinking, I want to go do something else. And what's the other person thinking? The other person is now thinking, I don't want to do something else. I want to do this. And then I say, let's go do something. And then the other person says, no, I don't want to go. And how do I feel and how do they feel? Start to teach her visually to actually think about what the other person is feeling based on what they say. So that's one thing. That's very important, and you should do that across a ton of different situations and scenarios that are similar to what you see her experiencing. That's one thing. Another thing is she just simply needs to do a lot more turn taking. So you need to do activities that will involve her giving up something that she wants for a time period. So you can actually give her a watch with a timer, anything like that and the explanation is, we're going to do this for 5 minutes, and then we're going to do what you want. And so you'll teach her to wait and be patient, and so that'll help transition much, much better. And then obviously after the 5 minutes, then you have to have have a child who, and I'm saying all this with the assumption that you will have peer dates or children that you can ask to sort of be a confederate with you and will do the things you want. So you'll have a child, could be an older child, another child, any other child, and they would say, okay, and you instruct the child ahead of time, and you say, when she says something that she wants to do, I want you to say, no, I don't want to do that. And then then you as the mom or whoever is working with her, prompt her to say, we're going to do this for 5 minutes, or we'll do your thing for 5 minutes, then we'll do my thing, and then practice that whole scenario with another child. This will help her a lot as well. And then finally, I would teach her also some relaxation activities, like things where she can divert herself, so that, sometimes you're not going to get your way, and that's that. And you have to be able to walk away from it. And perhaps for her, what would be good is breathing exercises where she can count and breathe and so on. And so really, you're not necessarily teaching her content, you're teaching her coping skills at this point. So, and you're giving her tools like a timer where she understands that I can do my thing, but then this person, we have to do their thing as well. And it has to be a trade-off where we are taking turns. So those are just some ideas, but I'm trying to, and really this is more of a behavior, and you have to realize that the function of the behavior for her tantruming when she doesn't get her way is just very simply, it's a tangible function. She's not getting something she wants, so she's throwing a fit. It's very, very clear. So you have to be very cautious that when she throws a fit in those scenarios, she doesn't get her way. She actually is then forced to lose what she wanted and rather do what they want. But having said that, the idea is always antecedent control is always easier than consequence control. So if you can predict that a tantrum is about to happen, then jump in and throw in those training techniques I just said. Interrupt it and say, remember, we're going to do 5 minutes of this and 5 minutes of that. Now, as I say this, I want you to realize this is typically what you do with typically developing younger children. Mm-hmm. Younger children are always fighting over toys or activities, or no, I don't want to do this, or whatever it is, right? And what do? You prevent them from fighting. You say, we're going to do your thing first and then your thing. With our kids, it's just a matter of giving them some sort of visual tool. A lot of times with our kids, they don't understand that they will actually get the thing they want if they're willing to wait and allow the other person, because they don't really have a concept of time.
Right.
A lot of times they don't really, because they're lacking that theory of mind perspective, they don't see that the other person is equal to them and also needs to have a list of things that they get done. Mm-hmm. And that's why comic strips really helps with that.
Wonderful. Great, great advice. And then feel free to write us back. And I love the idea of that, and it's something we haven't talked about very much, that when you have skills that it's working for you and you run into a period of time where you want some supervision, you can do that.
Absolutely.
And they can call the skills people to ask for that, correct?
Sure.
Mm-hmm. All right, great. We're going to take a break, and then we're going to come back with more Ask Dr. Doreen. Stick with us. Welcome back to Autism Live and to Ask Dr. Doreen. Dr. Doreen Granpeesheh is here with us answering your questions live. And we had a follow-up to the question that you were just answering about the girl who was struggling sometimes when other people didn't want to do it her way. I suffer from the same thing. Let's be honest. But Mom wrote back in and said, what should I do when she starts throwing things out when mad?
Right. And that's, again, where I was talking about the antecedent control. Like, you really need to try to prevent it before it happens as much as possible, because once it happens, just by having thrown the object, she's gotten attention and she's delayed the process of playing with that object or whatever it is. Like, she's gotten her way to some extent, even if you bring it back. So it's really much more effective if you can kind of see things starting to happen and prevent her from throwing. You know, if in circumstances where you can't, then a sort of a slightly overcorrective procedure might work, which is if she throws an object out, which basically means she's now delayed activity with that object, then I would probably set a timer and increase the duration of time she has to actually engage with that object that she didn't want to. Okay. So normally, if she throws an object, you could start and say, okay, now we have to play with it for a minute. And you set the timer and she has to sit there and engage with the object. Doesn't have to be a minute, it could be 30 seconds when you first start. If she continues to throw it out, you reset the timer, so every time she throws it out, she has to actually engage with that object for a longer period of time, which now delays her getting to do what she wanted to do. Yeah. Those are, I don't feel very comfortable giving you this level of advice now because it's getting very, very specific, and you really should have a behavior analyst there kind of, measuring the exact duration of time, getting her baselines, figuring out what's the appropriate protocol. I know it's hard.
It is hard. And I was just going to say, too, if you end up doing something along those lines, it's always great to have somebody else with you. If you can't have a BCBA, then having another family member, somebody who understands what you're trying to do, because it's hard to do by yourself.
It's unbelievably hard to do by yourself. I would not recommend it. I truly think that in most cases our kids actually do way worse for us because they are used to getting just their way with us, as moms.
Yes.
And I would just really suggest that you have a neutral new person come in and have that. But, having said that, I don't know what your resources are or where you are. And if you're a skills user, that means you're one of those gung-ho, I will do it moms, which I, of course, admire. And I want to be able to help in any way I can. But I do think that it starts to get pretty intricate when this type of behavior occurs, and you sort of need to have some more detailed guidelines. Give it a shot with the things that I suggested, and we can always try to help more on this call. But if it's something that's concerning you to the point where you think you need to fix it before school starts, then I would really try to get some professional help if you can. And contact us. We can help refer. Or we could give you a supervisor temporarily for a couple of months who could even just do FaceTime calls with you or Skype calls and help you that way.
Very good. Okay, I want to move on. This is a very interesting question. Hi, Dr. Doreen. Is there a safe age that a child passes that he is in the clear from autism? I have a child clearly has autism, but I have a baby that's 25 months old, still speech delay, but very social and has a few behaviors. Already getting intensive therapy, but I don't see what his I just don't see what his brother has. Mm-hmm. So is there an age when I can stop worrying that he will regress to autism?
Gosh, that is a very full question, and I want to make sure I respond to it appropriately in every way. So generally speaking, autism is a series of symptoms, right? So it's a certain number of symptoms that have to be present. Mm-hmm. Okay, that's fine. If there's 6 symptoms, then you have a diagnosis, let's say, of autism. If there's 5, you might have a diagnosis of, nowadays it's all ASD, but it's lower level. If you have 1, it could still potentially fit, but, it's much, much milder. So having said that, if it's a child who has every symptom, then obviously you would probably start seeing those pretty early on. And past the age of 2 years, which your child is, for instance, you said they have some speech delay. Okay, so let's just talk about that. But they're very social. But the child's very social. It is still possible that once you have speech delay, you start to develop other things a little bit later, like between 2 and 3, where you are getting frustrated, and so you start to have a lot of other behaviors. We don't really know yet with your child how they will progress from a sensory perspective. Does the child have sensory sensitivities, which could count as a symptom, but they could also develop a little bit later? Mm-hmm. The speech delay, is it to the level where it will, your child is social, I assume, with you. Once the child is in the environment of other children, will your child become more isolated because of the speech delay? Mm-hmm. So, in other words, what I'm saying is that some of the symptoms that you see right now that might be considered pretty mild, as the child grows up, their environment changes, and so those symptoms might become more influential in your child's development as they get older. Having delayed language is not such a difficult thing at 2, but it is a difficult thing at 4.
Right.
Because now at 4, it really stands out.
Yeah.
So don't get too hung up on whether they have it or don't. It's not a clear-cut yes or no. Just look at the exact symptoms that your child has and try to modify them. That's all. So and the sooner you get your child some assistance, whether it's just language delay or just anything else, and it's pretty insignificant right now, get ABA. Okay, your child's past 2, do some ABA right now with this younger child and catch up the language, because once you get the language to a higher level, you're never going to have to worry about any kind of social delay coming as a result of the language delay. So it's not like you step in and out of that box called ASD. It's not really. It's, certain days I feel like I have ASD because I can't socialize. My language is, I'm like sleep deprived, whatever it is. It's a series of things that are present all at once. So if your child has a few of those right now, just try to fix what there is and try to get your child caught up right now. So and the other thing I want to say, because it's also very important, is, Dr. Dennis Dixon and I some time ago wrote a book chapter on red flags and early signs of autism. And I don't remember for the life of me right now the title of the book chapter, but we can certainly get that information. And I would really recommend that you look up online just red flags to autism. There's a few things that you need to watch out for, and you need to maybe practice or give your child training in. And they're everything from eye contact to motor skills, believe it or not. So as long as you start, that's exactly, Shannon, why I made skills go all the way back to birth. Because if I have, and by the way, for this parent, it's very typical to have a first child who has full ASD and the second child who has minor symptoms of. Okay. And that's why I made skills go all the way back, because for those parents who are concerned about the siblings, if you use skills, if you go on our website, Skills for Autism, and you enroll your second child, you will get a bunch of lessons that are for very early development. They will be things like just play behavior, very early language stuff, so that your child will start to catch up with whatever skill they're delayed in.
Well, and I'm glad that you said that, because I was thinking, to me, it sounds logical that if a child is behind, we should give the child what they need to get them caught up. And we may never get to the point where they qualify for an autism diagnosis if we do that. But my sticky wicket here is that so many times your insurance won't cover that help unless you've already gotten the diagnosis, which seems to me to be a problem.
What an incredible observation. You're absolutely right. You're absolutely right. In California, that's the whole purpose of Early Start, is to be able to help our kids before they actually get a diagnosis. And that is the reality of things. And that's why I would say for those children who are much younger, let's say 2, what I would do if I didn't have a lot of funding for this, which insurance obviously won't fund you until you have a full diagnosis, what I would do is I would probably try to get family members, cousins, neighbors. I'd hire a high school student for minimum wage, and I would have them come every day for 2 hours and do the very early activities with my child, whether they're play-related, language-related, or whatever else skills tells me my child needs. And that's exactly why we produce skills and why we produce IBT, because the Institute for Behavioral Training will give you all the training this individual needs, web-based. They'll know exactly what they're supposed to do. And skills will tell you the content, what your child needs. So, please get started and get going, and don't let fear take up your time. Just get going with this and you can fix it.
And I would say to you that exactly what Dr. Granpeesheh just described, other people have done that and done it successfully.
Oh, absolutely.
There's a video that we show from time to time about Maddie, and that's exactly what Maddie's family did. They got together, family members and church members, they didn't pay anybody. Sometimes it's good to pay somebody, but they didn't. They didn't have the ability to do that, and they had volunteers, and they used skills, and they caught her up.
Yeah, that's exactly the case. I mean, I have kids who've recovered, and they've predominantly their therapists were people who lived in the same town who just wanted to volunteer time.
Yep. It's very, very doable, and so it's something that you have available to you. But the main thing always as a parent is we give our children what they need regardless of anything else.
That's right, of course.
And so your child has needs, and so finding the way to fulfill them, at least we've given you some ideas of how to do that, and write back to us and let us know. We're going to take a break, but before we do, I want to remind everybody that on the show tomorrow, we're having the wonderful Mike Hipple on, and Mike has been on the show before. He's one of our favorite guests, one of our favorite viewers. Mike is, I don't know whether Mike has turned 19 yet, but he uses assistive technology to communicate, and he is a big fan of getting that technology to our kids as early as possible who need it. He's going to be talking with you about that, and he's asked for you to send in questions that you have about augmented assistive devices today so that we can get those questions to him, and he can be working on them and getting them typed into his device so that he can talk to you himself about those things tomorrow. It's a really great opportunity to talk to somebody who's experiencing it. What are the frustrations? What do you wish you could ask your child and know what it's like from their experience? Because Mike can give you an eye into that, and he's going to be with us tomorrow morning. So send those questions in that you have about augmented assistive devices that help an individual to be able to communicate, and that will be tomorrow, but send the questions in today. We're taking a break. We're going to be back with more of Ask Dr. Doreen after these messages. Welcome back to Autism Live and to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh. She's answering your questions. They're flooding in, and there's so many good questions, and it always gets to this point in the hour, and I go, I gotta get as many questions in as possible. So this one just came in. Hi, Shannon and Dr. Doreen. My son, age 12, had a huge meltdown physical tantrum yesterday, the day before his first day of 5th grade. He never gets physical with anyone but me, and I'm his mom. My husband restrained him. He held back his tears. Wish he could cry. What am I doing so wrong that I'm the only one who gets these rare meltdowns and physical pushes and grabs? How can I help him stop attacking me?
You have to get a behavior intervention plan in place. You have to do a functional assessment. A lot of times I think people don't realize that our kids they're regressing, not because this is a symptom of autism, but because they're frustrated and can't communicate any other way. So most likely, I don't know, I'm just guessing now because your child was starting school. They were scared, perhaps anxious, did not want to leave you, did not necessarily want additional demands placed on them, don't like someone at school perhaps. I don't know. You don't know until you do a functional behavior assessment. Because what you need to figure out is, why did your child aggress? And in all circumstances, when your child does this with you, you need to know what actually is causing it to happen. Now, why is it just you? Most likely because when they aggress with you, you give in because you're mom and you try to nurture and comfort, which is what we do as moms. And there's nothing wrong with that. The only issue is that when you nurture and comfort the child right after having done an aggressive act, what you're doing is reinforcing that act without intending to. You're reinforcing the act, because when a reward or a calming or positive experience occurs after a behavior, whatever the behavior is, that behavior will increase, period. That's the law of ABA. So essentially, you need to, I guess the easiest way that I can suggest what you start doing right now is two things. One is, please go on our IBT website, it's Institute for Behavioral Training, and it's ibehavioraltraining.org, I think. .com. ibehavioraltraining.com. Please go on there and look at some of the modules for parents which are on the subject of challenging behavior. Just really learn those. And this is very inexpensive to do. I think modules range from $7 to, I don't know, maybe $12 or $15 or something, and you have the module for a month, I think. And so really learn the module, learn what a functional behavior assessment is, and then go on another website, which is BIP Builder. You can also go through CARD website. You can Center for Autism and Related Disorders. You can also go through the Skills for Autism website. All of our websites have a link to this.
And I think it's skillsbipbuilder.com.
Skillsbipbuilder.com. And there it starts with what's called a CIFA, C-I-F-A, and that stands for the CARD Indirect Functional Assessment. And you'll answer a bunch of questions about the times these behaviors occur, and then this will tell you the function of the behavior, which means the reason the behavior occurs in each circumstance. And then it will link you to some possible interventions, and that is the BIP Builder itself, and that is where BIP stands for Behavior Intervention Plan. And so the CIFA and the BIP Builder, the CIFA is sort of the assessment that asks you all the appropriate questions, and the BIP Builder is the plan of how to handle those behaviors when they occur. The two together will completely not only guide you, but everyone in your child's environment will now adhere to the same procedures and know exactly how to handle each situation. And I keep saying that because he might push you, so the behavior is the same topography, but it occurs for different reasons under different circumstances. So make sure that you conduct a CIFA for each situation that it occurs in. And don't worry, handling behaviors is not the hardest thing. Any behavior analyst can really help you with this as well.
And the only thing that I would add as a mom who my kid cycled 3 years in a row, it would only be in the spring, he would just start punching me in the head. Nobody else, just me.
Yeah, and that's like, you have the sweetest kid in the universe.
I do.
Which goes to prove that this has nothing to do with your child's personality. It just has to do with their frustration level.
And
it's
the
like
thing
they're
is,
trying to tell you, Mom, do something about this.
And honestly, I will tell you that, from a heart place, mom to mom, I know how much it wears on you when it's just you getting hit, because you feel like, and everybody looks at you like, well, what is it that you're doing? And sometimes we are inadvertently doing something that's helping it to stay in place. But I would say to you, make sure that you get some moral support from another mom who's been there and done that. And if you want to call me, I can hold your hand on the phone about that, because it feels bad. It's like a black place on your heart.
And it just makes you feel bad about yourself.
Ways, it does. And you start to feel incapable, which doesn't put you in the right place to do the intervention that you were just talking about. And you got to get to that place.
That's right.
So you need to have that part of you fed to know that you're a good mom, you're doing a great job.
Right.
This is not some horrible thing about you that your child has a deep-seated hate for you. It's probably quite the opposite.
Yeah.
That, I think with my kid, there's an element that he knew that he could get it away with me and that I was still going to love him later on that night.
That's exactly. In fact, if you think about it, the person that actually gets the higher level of behavior is the person that the child has had the most positive experience with.
Yeah.
It's the person that they turn to for help, because it's a cry for help.
Yeah.
That's what that behavior is. That behavior is, I'm frustrated, help me. I don't want to do this, help me. Help me get what I want. It's one of those functions.
Yeah.
So,
but it gets into an emotional thing for us.
Absolutely.
And so I just want to make sure that you're not alone in that the rest of it have felt that too, and make sure that you get somebody who shores you up in that department, and I'd be happy to do that.
Huge, important point.
So, because that's hard. That's hard.
And Shannon, that's like, I learned so much from you hearing those things, because we often, I can think of my own experiences with my own kids, and sometimes as they were growing up, and thank the Lord they're so much older now, but it is just so difficult when they're little, and things impact us in so many different ways. This morning one of their old nannies is staying with me, and we were just talking about how with one of my kids, with the youngest, how difficult it was sometimes in the mornings getting her up and getting her ready, because her outfits weren't perfect,
right.
And you could never tell if it was going to be a good day or a bad day. And it's a really stressful period of time.
It is.
And that's like the smallest thing, but she would tantrum over this every morning. But when I think about what our parents go through, I have to constantly remember that. It really shatters your self-confidence in many ways. I'm a behavior analyst, I'm a psychologist, I've lived this my entire life, right? Before before I had kids. And I would sit outside their doors crying when they wouldn't sleep or when they would tantrum or, 100 things happened with me and my kids. So
yeah, and I also hear in your question too saying he hasn't done this in a long time, and I think sometimes that's even harder when a behavior has gone away, especially something that's potentially violent or is violent, and it's gone away, and you think, I'm past that, and then it rears its ugly head again.
Right.
It feels like you're sliding back into oblivion, and it won't be because you're on it, and you're going to do something different about it. But it is an emotional roller coaster. So just want to acknowledge you in that way, and you are doing a good job, and you need some support too. Okay, we'll take a quick break, and then we're going to come back to do a bunch more questions. Stick with us. Welcome back to Autism Live and to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, and she is answering your questions. Okay, this is another great question. Is it normal that what my kid has mastered, he forgets? He's 3.5, has 40 hours of ABA through CARD, for example. He has mastered body parts, and now he can't find his chin. Also, are kids that are verbal and breezing through programs, will they always be spacey? I feel that no matter how much we teach him, he still wants to be alone in his own world. Is that going to get better in time?
Wow, great questions.
Yeah.
I'm really happy that you're one of ours so that we can communicate offline as well if we need to. Couple of different things. No, it's not okay to lose what you've already learned, but having said that, if you lose 1 out of 10 things, it's totally fine. So, he's learned 10 body parts and he just forgets chin, that's no big deal, because that's just normal learning. Okay, we do not retain 100% of what we learn. Nobody does. So that I'm not worried about. But if he's losing more than that, then you probably want to consult with me so I can make sure there's nothing else going on. And what I would do is I would start by doing some neuropsych testing, which will tell me how his memory works. Okay, this is one of the reasons that at CARD I require annual testing for my kids, and it's really hard because so many parents disagree with this and don't allow us to do this, and it's the most important thing. I have to check things like memory and processing speed and executive function. This is part of the reason we're successful, is because I get to look at those things. We all do here, and we're looking to make sure there's nothing underlying. So that's one important thing. What was the second part of the question?
Spacey.
Right. Okay, so he's only
he's 3.5 and he's breezing through programs, but he's still spacey.
This is going to be a while where you see that. Now it's funny because I want to. It's hard to explain this. So it's going to get less, definitely, where you're not going to notice spaciness. Second thing, though, is it might be just a feature of his personality, which will go on with him. Third thing is, despite that, I can't. The majority of it's not a prognostic factor. So in other words, being spacey or not being spacey in our loosely defined term of spaciness is not that important, because I have kids who've recovered who are still somewhat spacey. Okay? And they're not just recovered, they have finished college and they're working in really high level positions. Sometimes the people who are spacey are the ones that have extremely high intelligence, and they space out because they're bored with the pace of things. And
they're solving the world's problems in the back of their heads while they're looking spacey.
Or
That's
they're analyzing stuff.
Yeah.
Okay, so for instance, some of our kids are so, they don't realize it when they're 3, obviously, but when they're much older, they start to tell me these things. It's like, they'd be analyzing stuff, like, that was interesting. The sound of that door was kind of more interesting to me than what she just said. They're thinking about other stuff, they're analyzing stuff, they're much more deep, and they're learning in a different way. So let's not worry about whether or not they're spacey while your child is learning rapidly. Learning rapidly is the number one prognostic that is connected to overall outcome. So if your child's learning rapidly, you're in good shape. Having said all that, I would really recommend, and this is one of the wonderful things that I want to announce, and will in the next week as well. Starting next week, we have our physician, Dr. Linda Copeland, starting with CARD, and she is a developmental pediatrician with a lot of experience in autism, has been a pediatrician for many years, developmental pediatrician, which means that she's actually also an expert in normal development and also an expert in all of the tests and assessments that are required for children. And then on top of that, as if that wasn't enough, she's also a BCBA. She's a board certified behavior analyst, which I don't know anybody else in the world who has those credentials. So she's starting with CARD. It's just an honor for me that she's joining us. And in fact, Shannon, she's here next week in LA. So I really definitely want to get her on the show with you. We do, so therefore, Dr. Copeland's job here at CARD will be to see our kids and to evaluate our kids, also from a medical perspective. And my my recommendation to you is please try to get on her schedule. She will be stationed out of our Sacramento office, but she will be going to the other locations to see groups of kids as well. And then she will, of course, be happy to also provide ongoing pediatric services for all of our patients.
Wonderful.
And she is, what she would possibly look for is deficiencies, nutritional deficiencies that could sort of making like hypoglycemia. You never know if the child is spacing out because they're having momentary periods where they're just low blood sugar, or where they're not getting enough sleep, or any of those other issues that might relate here.
Okay, great. All super duper advice. And so if people want to get on the doctor's schedule.
Yeah, well, you're a CARD. This is a CARD family. If you're a CARD family, you should know you can always email me directly.
Okay.
Anytime you want to email me, please do so. Your supervisor has my email and information. You can call me. You can request a session with me. CARD families have access to me anytime.
Okay. I don't know that we all knew that.
Pardon?
I don't know that we all knew that.
Yeah, I mean, it's in your parent handbook. It's in your informed consent. You can always contact me anytime, please, especially if you're a CARD family. And you should know, right now we have a lot of senior staff overseeing our cases. It's this thing we've done at CARD, which is awesome, I think. And it's sort of the top 20, I would say, the most senior 20 people. Get to see every single case at CARD. Do you know we're doing this now, Shannon?
I knew that you could refer to them, but I didn't know that they were going to see everyone.
It's mandatory now. So the way that we've organized it is a fantastic process. So we have, as you know, every parent will now have what's called early start services or something with Vince Redmond.
Yes.
So every family who starts at CARD will have sessions, which I think we went to 6 hours or up to 6 hours with Vince per year, when they start.
Right.
In order for Vince to acclimate the family to CARD services, but then also just to give them some basic guidelines and to assess what level of information and training do they need.
Right.
Then the next level is Ryan Bergstrom, who we all love, and Ryan will then be able to spend the next 4 to 6 hours with the client, with the parents, training them. Just parent training for every family.
Okay.
For those families who are already in the system and will not have access to Vince, that is now Denise Ryan's job. And she's a senior as well. She was the manager for our Rochester office, but she's been in training department for years now.
Wow.
So Denise will now be doing Vince, same thing as Vince does, but with existing families.
Okay.
And then across the board, all of IBT, so Cecilia, Teresa, Jen, all senior supervisors, Sienna herself, Evelyn Kung herself, our clinical director, every single senior is overlapping with all existing supervisors. So every single case at CARD will have certain number of hours. We've already allocated this to seniors so that people like Carol and Kathy, like people who've been here for many years.
The rock stars. I mean, really what she's saying is the rock stars.
Right. They will be overlapping with your supervisors and reviewing your cases on multiple different levels. Not only your skills reviews, but all your assessments and tests, talking with you as parents, talking to reviewing your supervisors, programming, reviewing your therapists, programming, everything.
Okay.
So that's all right. I just
amazing.
Approved it, and we've already built it into the ERP, so that is in place.
Wow.
Yeah. So
that's very
families
exciting
will
for
have
families.
a lot more senior expertise, which I think is going to be lovely.
Absolutely amazing. So want to encourage you to utilize
Please,
all of
yes.
that while you're being concerned about these things.
Right. And supervisors already know about Dr. Copeland, so just tell your supervisor that you are interested in having an appointment with the physician if that's what you like, and we can arrange that.